Now baby is fully delivered. We have checked the APGAR score. Both mother and baby are in good condition. We are doing management of the third stage of labor. This session will describe the management of the third stage. We are going to look at how the placenta will be separated, and then we all know that it is a period where it's a period from the birth of the baby to complete expulsion of the placenta and membranes, and control of bleeding. So once the baby is out, we want to do complete expulsion of the baby and then stopping the bleeding. By the end of the session, it's anticipated that you'll be able to describe the normal physiology of placenta separation, explain the principles of active management of the third stage, and identify signs and complications during the third stage. So there's our session outline. And these are the major reading lists. We want to look at the principles of the active management of the third stage. In the active management of the third stage, oxytocin is given within 1 minute after baby is born and after ensuring there is no other baby. So here we palpated and ruled out the presence of a second baby. And once we were sure, then we give the oxytocin drug. Now once we give the oxytocin drug, we will not wait for any signs of placental separation. We go ahead to do control cord traction. So you pull the cord steadily. As it becomes long, you can readjust the forceps or you can use your hand. You get closer so you don't put undue pressure on the cord. You keep pushing the cord downwards, just like following the curve of Keros upwards. So as the placenta is becoming heavy, you support the placenta. Then you twist it so that you can deliver the membranes. So the membranes come out completely. You can have a quick glance at the placenta. You check the maternal surface. Are there any retained lobes? And then you can discard the placenta based on the protocol of the unit. Now you palpate a gentle movement so that if there are any retained clots, the clots will be expelled. So gentle contractions, gentle massaging of the uterus to bring out the clots. Now when you are sure the clots are out, you measure the amount of blood loss. Measure the amount of blood loss. And then you clean the woman. You inspect the vaginal walls. Now as you clean, you press the vaginal walls, and if there is any bleeding, you see the vessels where the bleeding is coming from. You also inspect the cervix for any lacerations. Now you go back to check on the perineum to see if there were any lacerations. You congratulate this woman. And you can ask somebody to provide her with a warm drink. Now we've delivered the third stage. We want to look at our documentation. Then we have had a quick examination of the placenta, but we'll be examining the placenta after cleaning the woman. We want to look at our quick documentation, then you go back to re-examine the placenta. So the condition of the mother on admission or first examination, we have recorded on the progress of labor, the drugs, any analgesics that were given, the starts and then the end of it, the method of delivery of the baby and who delivered the baby. All these things are in our documentation. Any lacerations and tear, any repair, condition of placenta and membranes and the cord, condition of mother after delivery with vital signs, condition of baby at birth, sex, birth weight, Apgar score, head circumference, chest, hip full length, maturity, and any other abnormality. I have said that all these things are legal documents, so record them. Make sure you have a good record and documentation. The third stage could be complicated by primary postpartum hemorrhage, acute inversion of the uterus, retained product of conception, which will lead to atony and lead to further PPH. Then we have shock and infection. We've come to the end of our third stage. We've said the active management of the third stage is currently the most practiced management of the third stage. It consists of the use of oxytocin drug and control cord traction and the delivery of the placenta. Life-threatening complications may arise in the third stage and it should be appropriately managed. And this brings us to the end of the third stage, and this is the summary, the references.